The impact of Ramadan fasting on diabetic patients, a clinical perspective. Our study concludes that Ramadan fasting does not pose a significant risk to diabetic patients, regardless of whether they have type 1 or type 2 diabetes, provided that their condition is carefully managed with appropriate medical guidance. A notable decline in emergency room visits for diabetic emergencies was observed, spanning the month preceding Ramadan, continuing through the fasting period, and extending into the month following Ramadan. This trend suggests that, contrary to common concerns, fasting does not necessarily exacerbate acute complications in diabetic individuals. Instead, it highlights the potential for metabolic adaptability when proper medical and dietary strategies are implemented. Clinical implications and risk mitigation strategies. The findings underscore the critical role of pre-Ramadan preparation, particularly in terms of individualized patient education, medication adjustments, and dietary planning. Structured medical counseling can help diabetic patients make informed decisions about fasting, ensuring that they modify medication regimens, for example, adjusting insulin doses or oral hypoglycemics to align with suhoor and iftar timings. Monitor blood glucose levels regularly to detect and manage fluctuations promptly. Adopt balanced nutritional practices, emphasizing low glycemic index foods to maintain stable glucose levels. Reduced healthcare utilization and public health benefits. The observed decline in visits suggests that proactive medical interventions can significantly reduce healthcare utilization during Ramadan. By equipping patients with effective self-management strategies, healthcare systems can minimize the burden on emergency services, thus promoting a more sustainable approach to diabetes care during religious fasting periods. Conclusion. Our study reinforces the notion that Ramadan fasting is not inherently detrimental to diabetic patients, provided they receive tailored medical guidance and adhere to best practice management strategies. This highlights the necessity for interdisciplinary collaboration among endocrinologists, primary care physicians, dietitians, and religious scholars to develop structured fasting protocols. By integrating medical expertise with cultural and religious sensitivities, healthcare providers can ensure that diabetic individuals observe Ramadan safely while maintaining optimal glycemic control. Further research with larger sample sizes and diverse demographic groups is recommended to strengthen the generalizability of these findings and refine fasting guidelines for diabetic populations worldwide.